Hi everyone, in this video we are going to learn about heart and its external features. Heart is a conical hollow muscular organ. It is situated within middle mediastinum. It is enclosed within pericardium. It is placed obliquely behind the body of the sternum and adjoining parts of the costal cartilages. It is placed in such a way that 1 by 3rd of it lies right to the midline and 2 by 3rd of it lies left to the midline. Human heart has four chambers: right atrium, right ventricle, left atrium, left ventricle. Atria and ventricles are separated by atrioventricular groove. Two ventricles are separated by interventricular groove. Two atria are separated by interatrial groove. Atria and ventricles are separated by atrioventricular groove. External features of heart. Heart has apex, base, five surfaces, four borders. Apex. Apex of the heart is formed entirely by left ventricle. Apex is formed by left ventricle. It is directed downwards, forwards, and to the left. Downwards, forwards, and to the left. Apex is situated in left fifth intercostal space, 9 centimeters lateral to the midline, just medial to midclavicular line. Apex is situated within left fifth intercostal space, 9 centimeters lateral to the midline, just medial to midclavicular line. It is situated in left fifth intercostal space, 9 centimeters lateral to midline, just medial to midclavicular line. Clinical correlation of apex. Apex beat. It is outermost and lowermost thrust of cardiac contraction during ventricular systole. Outermost and lowermost thrust of cardiac contraction during ventricular systole. Normally, apex beat is felt as light tap in left fifth intercostal space in the midclavicular line. It is felt as light tap in the left fifth intercostal space in the midclavicular line. In infants, heart is positioned more horizontally. Hence, in them, apex is situated in left fourth intercostal space in the midclavicular line. Normally, apex is on left side, but in the condition called dextrocardia, apex is on the right side. Dextrocardia may be a part of situs inversus. In case of situs inversus, there is reversal of thoracic and abdominal organs. You can see here there is reversal of thoracic organs and there is reversal of abdominal organs. Dextrocardia may be a part of situs inversus. Base of the heart. Base is also known as posterior surface. Base is formed by two atria, left atrium, right atrium. Base is mainly formed by left atrium. There is much portion of left atrium compared to the right atrium. It has the openings of four pulmonary veins into left atrium. Superior vena cava and inferior vena cava open into right atrium. Base is related to T5 to T8 vertebra in lying down posture and descends one vertebra in erect posture, T6 to T9. In lying down posture, base is related to T5 to T8 vertebrae. In erect posture, base is related to T6 to T9 vertebrae. It descends by one vertebra. Base is separated from vertebral column by oblique sinus, esophagus, and aorta. Oblique sinus is present behind left atrium. Base is formed by both atria, mainly left atrium. Four pulmonary veins opens into left atrium. Superior vena cava and inferior vena cava open into right atrium. In lying down posture, it is related to T5 to T8 vertebrae. In erect posture, it is related to T6 to T9 vertebrae. Base is separated from vertebral column by oblique sinus, esophagus, and aorta. Surfaces and borders of heart are given differently in different textbooks. I have taken my reference from Gray's Anatomy. Surface of heart. There are five surfaces: anterior or sternocostal surface, inferior or diaphragmatic surface, right pulmonary surface, left pulmonary surface, and posterior surface. Posterior surface is also known as base. Sternocostal surface. It is formed mainly by right atrium, right ventricle, partly by left auricle, left ventricle, left auricle, left ventricle. Left atrium is not seen on anterior surface. You can see that there is no left atrium in the anterior surface as it is covered by aorta and pulmonary trunk. Aorta and pulmonary trunk. Most of it is covered by left lung. A part of it is uncovered by lung. Most of this surface is covered by left lung. A part of this surface is uncovered by lung. This uncovered part is dull on percussion. Hence it is referred as area of superficial cardiac dullness. Inferior surface or diaphragmatic surface. Inferior surface or diaphragmatic surface, it rests on central tendon of diaphragm. 2 by 3rd of it is formed by left ventricle. 1 by 3rd of it is formed by right ventricle. Right ventricle and left ventricle are separated by posterior interventricular groove. Left pulmonary surface. Left pulmonary surface is formed mainly by left ventricle, partly by left auricle and left atrium. You can see the left pulmonary surface is mainly formed by left ventricle and partly by left auricle and left atrium. In its upper part, it is crossed by atrioventricular sulcus. Right pulmonary surface is rounded, it is formed by right atrium. Now let's revise the surface of the heart. Anterior or sternocostal surface, it is formed mainly by right atrium, right ventricle, partly by left auricle, left ventricle. Left atrium is not seen on anterior surface as it is covered by aorta and pulmonary trunk. Most of this surface is covered by left lung. A part of it is uncovered. This uncovered area is known as area of superficial cardiac dullness. Inferior surface or diaphragmatic surface, it rests on central tendon of diaphragm. 2 by 3rd of it is formed by left ventricle. 1 by 3rd of it is formed by right ventricle. Left pulmonary surface. Here we have to just remember that it is partly formed by left atrium also. Left pulmonary surface, it is mainly formed by left ventricle, partly by left auricle and left atrium. Right pulmonary surface, it is rounded, it is formed by right atrium. Borders of heart. There are 4 borders: upper, inferior, right, left borders. Right border, it is more or less vertical. It is formed by right atrium. It extends from superior vena cava opening to inferior vena cava opening. Left border, it is oblique, it is curved. It is mainly formed by left ventricle. You can see it is mainly formed by left ventricle and partly formed by left auricle. Mainly left ventricle, partly left auricle. It extends from left auricle to apex. Inferior border. Inferior border is nearly horizontal. It extends from inferior vena cava to apex of the heart. It is mainly formed by right ventricle and partly by left ventricle. Incisura apicis cordis is a small notch on the inferior border near the apex of the heart. It gives passage to anterior interventricular branch of left coronary artery. Upper border, it is formed by 2 atria, mainly left atrium. Upper border is mainly formed by left atrium. Anteriorly, it is overlapped by pulmonary trunk and aorta. Now let's revise surfaces and borders. Surfaces of the heart, 5 surfaces. Sternocostal surface or anterior surface. It is formed mainly by right atrium, right ventricle, partly by left auricle, left ventricle. Inferior surface or diaphragmatic surface. 2 by 3rd of it is formed by left ventricle, 1 by 3rd of it is formed by right ventricle. Left pulmonary surface, it is formed by left ventricle mainly, partly by left auricle and left atrium. Right pulmonary surface, it is formed by right atrium. Posterior surface or base, it is formed by both the atria, mainly left atrium. Next borders, 4 borders. Upper border, inferior border, right border, left border. Upper border, it is formed by 2 atria, mainly left atrium. Inferior border, it is mainly formed by right ventricle, partly by left ventricle. Right border, formed by right atrium. Left border, formed by left auricle and left ventricle.